Hi everyone, it's your favorite rheumatologist, Dr. Kwan here with Joe Copa from Pro Health Physical Therapy. We've been having a lot of patients who've been having back problems of sorts. They can range from anywhere from spinal stenosis to degenerative disc disease to arthritis of the spine, sciatica. So Joe, with all these patients in this rough winter we've had, I don't know if there's some things that the patients should be reminded to do from a physical therapy standpoint.
Yeah, absolutely. There are some things you can do at home that can be very helpful.
Awesome. Well, if you can show us, that'd be great.
Yeah, sure. So, a lot of times what I find is that people wake up in the morning, they're pretty stiff. So before you even get out of bed, there's a few things you could start trying. So when you're ready, you climb on up here and you can lay on your back. So we're going to start with your legs out straight. And these are called gluteal sets. We're going to just contract your butt muscles. So before you even get up in the morning, I want you to just kind of squeeze for 3 seconds and then relax. And you're going to do those 10 times.
Really? Okay, let's try it. 1, 2, 3, relax.
Good.
1, 2, 3, relax.
Now if that causes any pain, don't squeeze as hard. And if it still causes pain, just stop.
Okay, that seems pretty good. Although, quite honestly, I can imagine 3 isn't so bad. I bet you getting to 10 will really start to work them out, huh?
It might, and that's part of the goal. We want to start getting you some strength in your hips. And while you're lying in bed, this is a good place to do it.
Awesome.
So the next one, you're going to bend both of your knees. You're going to pull one knee to your chest at a time, but I want you to grab from behind here. Give a gentle pull. 10 seconds.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Good. And then you can put it down and you do this side.
1, 2, 3, 4, 10.
Good.
I've seen people also do it with like a towel or like a belt. Is that a different exercise or is that very similar?
It might just make it easier to grab.
Oh.
So you could have a beach towel and then it might be easier. You don't have to reach as far.
Okay. Okay.
Yeah.
So people who need that, can you do that?
Absolutely. And I would have you do 3 times 10 seconds on each leg.
Okay.
The next one, you stay in this position with your knees bent, and you're going to gently rock a little to the side, and then back this way. You only go to the point where you don't have any pain. If you have pain when you get to a certain place, you have to stop and shorten it up. 10 times back and forth. You do not have to hold it.
Okay.
This will help to loosen your back in rotation. Always nice and controlled, nice and steady. 10 times each way.
Now, should people be doing this in their bed if they have a soft bed, or does it matter, or should they do it on the floor?
It's okay to do it in a soft bed. Some people might prefer a little more firmness underneath them, but if you're very sensitive and mornings aren't so good for you, I would just do it right in bed.
Okay, great.
So the next one, actually, before you do anything, we want to make sure you get upright, which means you need to roll onto your side.
Oh.
Bend your, and you're going to let your legs come off the edge and push with your arm. You should always get in and out of bed that way to minimize the stress on your back.
Oh.
So now you're ready to start your day, and you may still be kind of stiff, so go have breakfast, loosen up, and at some point I want you to do some stretches sitting in a chair. So we're going to use this chair. I'm going to have you sit right here. And I'm going to pull this out. So I want you to spread your knees a little bit, scoot forward to the front of the chair a little, and I want to see if you can stretch down in between your legs. If you feel a good stretch, you can hold that for 10 seconds and then come back up. And we would do 3 of these. For some people, this could be too difficult, or if you don't feel like it stretches, you can do it a different way. You're going to be close to your kitchen table, and you can put your hands on the table and then try to stretch down. You might get a better stretch that way.
Gotcha. Well, I hate to be brutally honest, but I think my belly's getting tired. It's a little bit sore.
Yeah, and
All
a lot
right.
of people
So-
will say that.
so
this
we
could
try
be
this way.
Yes, and this could be a better alternative.
Okay, so what I'm really stretching is my back, but I can definitely feel this. Actually, if you did it wrong, you'd be stretching your shoulders too, huh?
Yes, but you might feel the stretch up to here, and this is still going to help to loosen your back.
Got it. Yeah, I do feel the upper back, so that helps a little bit.
If you feel like that's not enough of a stretch, now you can lean to the sides and get one side of your back at a time.
You like this?
Yes, and you'll feel it all through here, right?
Yep.
And you could bend forward a little more and you might get an even deeper stretch.
Do I do this like 10 times? Just hold it for 10 seconds?
10 seconds, 3 times. And then you could try the left. Yes, so now you're stretching the left side. With your hands to the right, you stretch the left. And that's perfect.
Wow, I don't think my back has been stretched that much in a long time, because I could feel it actually.
Yeah. So the next one, stand for a second. I want to turn this chair. You're going to sit again. This is a stretch for your hip. You're going to cross a leg, and you're going to pull towards your opposite shoulder. If you're doing this right, you're going to feel it right in your butt. And don't lean.
Oh.
There you go. Sit up straight.
Oh, yes, that makes a big difference.
Now you feel it in your butt.
No, my patients who have gluteal pain, basically would you describe that as lower back, or is it really butt pain?
Well, it could be the hip rotator that's tight, but when that is tight, it can create sciatic nerve, cause buttock pain. It can even radiate down your leg. So this would be a great stretch if you feel it in your butt, and usually it tightens up to protect your back. And you might notice that one side is tighter than the other.
Wow. All right.
10 seconds, 3 times. And there are a couple of exercises you can try for strength. So you're going to come back up here, and you're going to lay on one of your sides. We call these clamshells. You're going to bend both of your knees. Yes. Now the goal is to keep your feet together, and you lift the top leg only as high as you can without rolling backwards. So lift for me. Perfect. You can start with just 10 times, and as you get stronger, you can work your way up to 30. Believe it or not, this might make you pretty tired.
I believe.
Yeah. And again, you might find one side is weaker than the other. But this is a great exercise. It's very simple.
Okay.
In the last one, you can lay flat on your back with your knees bent.
You obviously would do that in both sides, right?
Both sides, absolutely. Working your way up to 30 times. So bend your knees in a little bit further. This one too. This is called a bridge. And the goal is to lift your butt right up off the table here. Hold for a couple of seconds, and then down. Now the height is not the most important thing. Some people get to a certain height and it hurts. So even if you just stop there, you're still using your muscles. I don't want you going too high. And then down. Again, you could start with 10 times. And as that gets easier, you work your way up to 30. And that's
Excellent.
a good little program.
Oh, this is terrific. Joe, thank you so much.
You're welcome.
This has been awesome. As always, we appreciate your guidance and our
You're
help
very welcome.
in helping our patients with back pain. So here you got it, folks. The exercises for your lower back. Get to them, and we'll direct you as we see fit to this link. Take care.